And it is my great pleasure to welcome Molly and Sandrine. And by virtual presence, we also have Walter with us. Uganda is having elections today, and so certain areas have got internet connection issues. So Walter wasn't able to join us this morning, but he was very um, what's the word? He was organized and sent us a presentation, which Molly will share by video. But first of all, over to Molly. We are talking today about using community-led monitoring, evaluation, accountability, and learning methods in community development, CoLMEAL. And we also have Alex with us, who's also a colleague from the ADRA, the Adventist Development and Relief Agency. So Molly will do a quick introduction, and then she will share the video from Walter on his behalf, and then Sandrine will give us some examples of case stories and experience that she has from the ground, and then Alex will help us with some Q&A. So that's the program for today. Welcome to the team, and over to you, Molly.
Great. Thank you so much. And thanks to everyone for joining today. So excited that we have the opportunity to speak with this group. And thank you to Daniel and Janine and Anna and the others from IACD for allowing us this space and this time, especially considering, yeah, we're new to the world of IACD, so we really appreciate this. My name is Molly Grove. I'm based in Toronto, Canada, and I work as the manager for global impact with Salanga. Salanga is a partner of ADRA Canada, ADRA Uganda, some other ADRA entities as well. But we are our own kind of entity. And I'm joined by my colleague Sandrine, who's based in Rwanda, and my colleague Alex, who's based in the Philippines. Salanga is very global. We've got colleagues on most of the continents, I think. Um, so I'll just dive into things a bit more, but just to say that we're happy to see questions in the chat, and maybe we can answer as we're going or just collect them. There'll be, I think, plenty of time for Q&A. As well, I'll drop my email and contact information in the chat at some point. I welcome anyone to reach out to us after the fact if you'd like to talk more about this CoLMEAL approach or you're interested in applying it within your own work. Um, and like Janine said, unfortunately, Walter was not able to join us, so I will just give a brief introduction about CoLMEAL and then jump over to his video before handing it off to Sandrine. So it will be about a 20 minutes of video with Walter. Um, and just checking my notes, that's everything I needed to say. Great. So Salanga is the co-creators and stewards of the CoLMEAL approach for scalable, data-driven, and community-led development. And through our research and close collaboration with communities, partners, funders, and networks, we've co-created, piloted, and continue to evolve and scale up practical ways to enhance localization and community-led meal. CoLMEAL is originally an acronym, although we're transitioning to it just being a word for the approach in itself. It's a principles-driven methodology that systematically positions communities to define, measure, and lead their own development journey. And it's a structured yet flexible framework and a guided journey that enables communities. It could be in all their diverse forms, a village, a government entity at a sub-district level, a group of GBV practitioners. You know, we define community quite broadly, but it allows them to collectively assess their reality, establish their own markers of success, and use data that they generated to learn, adapt, and drive tangible change by placing the tools of assessment, planning, monitoring, and learning directly into the hands of the community. CoLMEAL ensures development is not only community-led in principle, but is also community-owned, evidence-based, and sustainable in practice. And the process is designed to create protected space for the voices of those most affected and most marginalized to ensure that they're not just consulted, but they are central to analysis and decision making. CoLMEAL is, like I said, a guided journey, but in every context, it's localized to the context, the language, the examples. All of the tools are localized depending on the place of implementation. But we maintain the approach through adherence to our core value and our six guiding principles. So the core value of CoLMEAL is that for sustainable social change to happen, it's essential to enable everyone in the community to exercise their power over the direction and control of agendas, data, decisions, and resources, and that this is achieved by enhancing their capacity and motivation to drive, own, and measure the change that they collectively seek. And we build on this core value with these six principles that are central to all of our work. So the first one is community ownership. So having people in the community define and own their own development journey. It's about collaboration, inclusion of all voices, making data-driven decisions, adaptability, and accountability. We've piloted and evolved our approach since a project starting in 2019, although the thoughts behind our approach started well before that. And we've been applying it through multiple different thematic areas, different countries, and different implementing organizations, from the Bright project up until our newly launched project called Stronger, and there's others not listed here as well. But this is just a brief snapshot of the journey. And we've implemented CoLMEAL now in 9 countries and over 90 communities. So we're really excited about how it's grown and about the place we're in now to expand it further. And so this is just a map of where it's been applied around the world. And in order to implement in those 90 communities, we've trained over 60 facilitators in the approach, and they've engaged over 5,000 individuals in the communities. And of those 5,000 people, 96% have reported improved self-confidence and improved critical thinking. And those are just some of the kind of measurements that we've done to assess the approach. One of the most compelling pieces of evidence, and you'll hear Walter talk about this too, is that communities are organically spreading the approach with their neighbors. People are observing it in their neighboring communities and asking to be trained in their own community. We've seen government officials pick up the approach and apply it within the correctional facilities or probation offices. So it's really heartening for me to see that. I think it demonstrates the value that communities see in it, the benefit that it's serving them. So that was just one piece of evidence that's not really a number, but I always like to share that piece as well. And so just before I share the video of Walter, I'll just set up that Walter is the CoLMEAL officer for ADRA Uganda with the Together project that's being implemented in northern Uganda in partnership with ADRA Canada and Selanga and funded by Global Affairs Canada. The Together project aims to improve healthcare access and outcomes for vulnerable communities, especially women and girls in Uganda, Kenya, Cambodia, and the Philippines. And one last note is that Walter uses quite technical language in his presentation, but just to assure you that when implementing the approach in communities, this isn't the type of wording or language we might use. It's all localized based on the language, but also just the literacy levels or the education levels of a community and what examples might make sense to them. So he's kind of flipped it back, so because of the audience, to use some of that more technical meal language. But I just wanted to kind of promote that as it really relates to our principles that we wouldn't necessarily be using indicators and monitoring map in a community. Great. Okay, I've talked a lot for 3 a.m. So I'm going to, let's see if I can exit full screen. And now I'm just going to stop sharing and share again to make sure the audio is connected. And here's Walter.
Everyone from wherever your respective locations. My name is Walter Kibwota, CoLMEAL officer from ADRA, Uganda, Together Project. It is a privilege for me to have the opportunity and speak in this very big forum, presenting the uniqueness of CoLMEAL approach in Uganda. I really appreciate the organizers for this very important meeting, and I would like to begin by actually, just like as you can see from my presentation, the heading is like, today we want to know more about how can community development take place through CoLMEAL. So the heading is talking about community-led monitoring, evaluation, accountability, and learning. That is the CoLMEAL approach in community development. CoLMEAL, just like the way we put it down here, that there is no, actually, the way we experience from ADRA, Uganda, Together Project, CoLMEAL approach, we normally looked at CoLMEAL as if there is no power for change rather than a community discovering what it cares about, just like said by Margaret J. Whitley. Allow me to move to the next slide. CoLMEAL versus conventional meal. What do I mean here? There is a comparison, as you can see from this slide. Conventional meal is normally externally driven. That could be like the demand from M&E department. They go to the community and then they want to collect the data. But now for the community, it is a community driven. That yes, this is what we want, this is what we want to do. The conventional meal also require like the technical focus. They pay much attention in the technical part of it, the mill, M&E, those people need a lot of things. But when it comes to the CoLMEAL, yes, much as it is there, they don't require a lot of technical issues yet, but there is that element of empowerment focus, such that they are able to do on their own. Data for donors. When it comes to conventional meal, there's also data for donors. You see, it is a donor-driven. That we need data because they want to compare. There's a level of GPV, there's a level of teenage pregnancies, or maybe there's a level of alcoholism. So the data, it is always need for the donors. But now when it comes to the CoLMEAL, that is for the community action. When community realize that there's a lot of alcoholism, they will take action so that they use that. So the data is for the community. And then when it comes to the conventional meal, there is that limited feedback to the community. But when it comes to the CoLMEAL, there is a stronger accountability to the communities. Community will always have a feedback during community dissemination session that they share exactly the data that's collected by themselves, and then the level, and then the impact, the negative impact about it. So the community are able to feel there and then. But when you look at the limited part of the conventional part of the limited feedback, it's like being used by external people so they don't. Why CoLMEAL? Sometimes you wonder why you say CoLMEAL matters. Put communities at the center of monitoring and decision making. That's why we're saying why CoLMEAL. It strengthens accountability and transparency, produces more accurate, locally relevant data, enable continuous learning and adaptive programming, builds local capacity and empowerment, improves sustainability of development outcomes, promotes inclusion and equity. When we looked at the CoLMEAL operationalized in Uganda context, in our setting, development projects often speak about participation, but rarely surrender control. But CoLMEAL puts communities not just as data providers, but as owners of the entire meal process. In doing so, we unlocked deeper, relevant, faster mindset change and sustained accountability. In Uganda specifically, CoLMEAL is being implemented actually in 18 CoLMEAL villages as the target of the project at the beginning. But because CoLMEAL was so good and everyone loved it, there were 3 additional CoLMEAL communities that emerged. So that is where we have it, and we are in East Acholi sub-region. So those are the numbers of the CoLMEAL communities. Now, when we're implementing CoLMEAL, there are these key steps that need not to be skipped. Otherwise, if it is skipped, then at the end of the day, CoLMEAL is not coordinated. The first step is organization setup. The second step is assessment and design. The third step is indicator development. You do monitoring, map and plan. There's tool sampling and data collection. There's what we call tool development. There's data analysis and dissemination. These steps are so paramount. Once all of them are taken care of and facilitated perfectly, there you will see now the beauty of CoLMEAL. So allow me to at least go through some few steps here down. Organization setup. CoLMEAL in our context means working with local structures, religious leaders, VSTs, local government leaders, people with disabilities, female and male champions to identify what matters, measure what counts and act on it together. What do we do in assessment and design? Community identify problems, rank and prioritize them, identify and rank root causes and develop the theory of change where the community problem becomes the goal and the root causes become the outcome. So under assessment and design, that is what normally takes place. Indicator development, the community define the purpose and the purpose of the monitoring, community issues, identification, prioritization, translate priorities into measurable results, create indicators with community, test indicators for quality and feasibility, define data collection methods and roles, validation and joint agreement, and continuous review and adaptation by the community. So that is about the indicator development. Monitoring map and plan, community outline the purpose of monitoring, what will be monitored, the monitoring map, who monitors, how data will be collected, when monitoring happens, data uses, learning. The monitoring map shows what matters. The monitoring plan shows the community act on it. And monitoring maps also here help community to understand where they can identify the data from. The monitoring plan gives the community the directions, the frequency, who has the data and when and how can they collect the data. So when we talked about the monitoring map and monitoring plan, it is very, very important. Tools development, as communities develop their theory of change, they need to develop the tools such that they are able to collect the data. So here, communities identify and develop participatory, simple, and community-friendly tools such as attendance list, survey form, and sampling method. They use participatory and inclusive sampling, and they are trained on data collections. After data collection, community then analyze their data with technical guidance from the MEAL teams and disseminate the finding result to community for approval.
CoLMEAL is a very interesting approach that it is my first time to come across it compared to some of other approaches. What made it so good to me was like when you go to the community, they just display to themselves their common issues which are affecting them. And the good news in CoLMEAL is like you do not only pick the issues of the community. The community pick their issues and they go ahead and prioritize. As if I'm to compare with other approaches whereby we only end up picking the issues from the community and we go and design. But the CoLMEAL again make community to prioritize the top issue, and then they prioritize and then they go ahead looking for the root causes by themselves. And we did it in 18 CoLMEAL groups, and interestingly, most of the CoLMEAL groups, they were identifying their common issues as being the gender-based violence related issues, low level education, and alcoholism. All these 18 CoLMEAL villages, they were circling themselves around that areas. And as a result of that one, most of them were putting their targets like, we want to reduce GBV. And in the process of like, how do you reduce GBV? They ended up by identifying the key or major root causes of gender-based violence. And across almost all over the 18 villages, alcoholism had been almost number one. All the 18 villages, alcoholism is the root cause of GBV, laziness is the root cause of GBV, low level education is the root cause of GBV. So most of them narrowed within that area. Then having known, if it is alcohol, it is the one causing the gender-based violence. Who should now stop alcohol? Who should now stop you from drinking alcohol? And then they look, okay, if alcohol is the major root cause, what should we do? And they started designing themselves, the solution by themselves. Some of the community were saying, we need to come up with a bylaw, such that this bylaw will help us, especially in the time, regulating the time for taking alcohol, such that people can first of all go for the garden work, and then they come and start maybe taking alcohol like around midday, such that one reduce the time of taking alcoholism, and then by doing that, it also reduces laziness. And very many community did in different ways. Others bylaws, others sensitizations, and due to that one, there were a number of achievements that we have seen in most of the communities.
What is a bylaw?
Bylaw is a set of rules which is agreed by a particular community. For example, they would say, we want this village of ours, such that taking alcohol that people normally start taking right up from the morning, like at around 8 a.m. For this case, we want to agree that in this village of ours, people should start taking alcohol by like from noon, like at 1 p.m. onwards, and then it should stop by around 8 p.m. in the evening. So when they agree in that, that becomes a bylaw to them. And other villages, they agreed like, we want like alcohol should no longer be like sold in our village. If people want to let people go and get from a neighboring villages. And that is a kind of a bylaw. And another bylaw is like sometimes they would say, we don't want anyone who has taken alcohol to use vulgar languages. And the moment we have heard you doing that, there is going to be a kind of a penalty. So they agree as a community, and all of them follow and never fall into it, will not escape from that kind of punishment. They give a kind of a lighter punishment which will not overshadow the government policy. So that is the bylaw that they had been using in some of the villages that made them actually to reduce the alcohol consumption in some of the villages. And as we talk right now, we have realized that reduction in alcohol consumption has contributed to increase in enrollment of children at school, the young girls, the young boys, and very many of them have now enrolled to schools. And then reduction in alcohol consumption has also led to a reduction in gender-based violent cases. It seems there is a connection between alcoholism and GBV, which means GBV, alcohol is like a leading root causes of gender-based violence. So as I talk right now, out of the 18 villages, we went and like doing some kind of monitoring, kind of feedback, kind of focus group discussions. So most of the communities in their gathering, they were telling us very good positive feedback. Some of them said they have seen a very good reduction in alcohol consumption. Some of them are telling us now we have seen a number of children going to school. And the young girls were saying those days the parents used to abuse them for not having gone so early for the marriage. But now they've realized that that is another source of gender-based violence. So there is mutual understanding between the family members, and there is a reduction in laziness because we've already seen laziness is also part of the root cause of GBV when you're lacking something in your household. So we have seen that kind of a very good reduction, and also we have seen a number of communities that have done tremendous things. Like in one of the villages, there are two nursery and primary schools that emerged from CoLMEAL intervention because they have realized that education is key for their community, and there are those two primary schools that came. It started this year and is moving on well. And then another village that also did something tremendous. They gathered a nearby community together, and then as a result of that one, they contributed their own money, their own resources, and they constructed a temporary bridge that normally used to disturb their children from accessing services or mainly like schools. So as we talk right now, that school has a very good temporary bridge. The motor bicycle can pass very well. Bicycle, even children can move, so they're able to access services from the nearby town. And as I talk right now, yes, there also could be another challenges in CoLMEAL intervention, but generally we have realized the good part of it. The approach brought community together, and there is a very big unity among the community members. They are working together. Youth had been brought into the committees, of which they are now participating in identification, or they are participating in the ideas that should be brought in the development of their villages. And women are also being empowered. There are a number of the CoLMEAL groups that are being led by the women, being led by the youths, and community are able to do the data collection by themselves. And data is another something which is very sensitive for them, helping them to understand that this is where we are. And yeah, there are also some kind of challenges that I must also not forget about it. CoLMEAL, it is a very, very important and interesting approach. And I would like to give my sincere thanks to Salanga, especially for coming up with the ideas of the CoLMEAL approach, which is very unique. I would say CoLMEAL, it is a tool for sustainable development. With my experience that I've been working in NGO world, coming to around 15 years, had never come across this approach. Still, I would still re-echo that it is a tool for sustainable development that need to be continued, expanded. But also, I must tell Salanga that they have already left a legacy or a very big root structures in Uganda that will never be uprooted. Where we have reached with the 18 CoLMEAL villages, I'm saying this because there are clan leaders that came on their own, and we already trained them. Some of the parishes also came on their own through the government, especially in Adilang sub-county. They came and they facilitated everything. We trained them, and very many more communities are still demanding, which means from next year we are most likely to train another 4 different CoLMEAL communities that they are going to facilitate on their own, which means CoLMEAL has already come to stay in northern Uganda. I would like to thank the GSC, Global Fair Canada, for the fund that they have put into this project through ADRA Canada, through ADRA Uganda, and then for us, the national staff that participated in trying this pilot in terms of CoLMEAL intervention, that they did great work, and the fund had not been taken in vain. There are a number of success, there are a number of family members which are really rejoicing, and many more are yet coming because of that funding. I'll just say this, and thank you so much. God bless, and we will continue working together. Thank you so much.
Good morning.
Great. Thank you all so much for sitting through the recording. I know that that's probably not how these meetings normally run, but I was really happy to be able to include Walter's voice and perspective and share that with all of you. I will now pass to Sandrine, who will share a bit more about the Together project in Northern Uganda.
Thank you, Molly. Am I audible enough?
Yes.
Okay, yeah. So I was able to also witness CoLMEAL in action when I visited Uganda, and from what Walter was sharing, I saw CoLMEAL working. And as all of you sitting, I had also heard about CoLMEAL before, but it was a great opportunity to witness actually how does all this come together. Like my first visit, I visited a community called Lukewarm North. It's also in the northern Uganda, and in this community, the community was identified as just being known for heavy drinking. And I was so surprised when I reached there and I could only see very calm streets, women selling vegetables and hearing, students in the schools. So I was very curious to know how did it happen. And I met CoLMEAL committees in that community. And the CoLMEAL committee are usually made of different people representing different levels of leadership in the communities. You will find like chief leaders, religious leaders, youth representative, women representative, clan leaders, and other, different leaders in the community. So they all come together. You even see youth, representative of people with disabilities. So every person, every category of people is represented. And we had a very interesting discussion where they were able to take me through how all the changes I was witnessing had come to happen. And one of the change that happened was that the community came together, and as they were discussing with the facilitation of the CoLMEAL committee, they were identifying their problem. They were asking themselves, like, what's wrong within our communities? What's happening that is not going on well? And different people voicing out different issues. And most of the issues that were coming out was high level of alcoholism. They call it the low level education. They say it's high level of ignorance, and also families in conflict, which means high level of GBV. And as the communities were discussing about all these issues, they realized, like, why do we have high levels of ignorance, which is low level of education? And it came to be that when they were having the discussion, one person stood up and shared about how actually the high level of ignorance, many people are saying we don't have the means, there is no money to send students to school. But then he shared with them how actually every person who drinks spent about $200 per year, and yet sending a kids to school would only cost a $10. So that really sparked great reflections in the communities, because they now were wondering, if you can have money for drinking and yet you can't have money to send a child to school, then there is a problem. And that's what then brought the conversation about what can we do about it. And the idea came that there is need of establishing a school in that community. And that's how the CoLMEAL committee then invited some people who would be interested to set up a school. And in that meeting, they were able to, two people volunteered. And among the two people that volunteered, one of them was a CoLMEAL committee member that had a bar in that community and was willing to give it up so that it can be rented and be transformed into a school. And that really brought great changes, and also a shift to show that now we want this change and we are willing to do anything to contribute to this positive change in the community. And as also part of reducing the level of alcoholism, the communities also agreed to set a bylaw, which is what Walter shared with you. It's an already existing structure, but also supports, CoLMEAL in the way community actions are driven, that the communities decide, but they also have a structure that would help them enforce whatever they decide. And the bylaw was that the alcohol will never be sold in the morning hours. It will be sold from 2 p.m. to 8 p.m. What that resulted in the community lives is that, as before, people were only spending the whole day drinking and unable to go into their activities. Now, with that bylaw, people would spend their mornings in productive activities, which also affect their livelihoods and also improve the lives in their families, because they realized that after they had set that bylaw and the level of alcoholism was reduced, it also affected the family, and they were like the level of GBV reduced. So in that community, I saw that CoLMEAL does not only rely on what you decide, but what the community decides, and the change they want. And they're the ones who owns the change, because even when they were able for them to decide which like the students to be sent to school, or in encouraging parents, they had conducted a data collection. They went to each household asking simple questions like, how many children do you have who are to be at school, who are in school, and who are not at school? And the results was like 90% of the children were not in school. And that also helps the community to decide and to realize the scale of the problem, like how big is the problem. And that also shows the data-drivenness of the whole process, that the communities are able to collect their data and be able to decide based also on the data, which shows that then CoLMEAL becomes an evidence-based and also grounded in shared understanding within the communities. Because in Lukwa North, when I visited, just like from, it's the first time that they were going to have a graduation of a nursery students. They had never experienced that, but it all came as a result of communities coming together, share their problem, prioritize which ones to tackle, conduct that data collection to understand the scale and the depth of the problem, acting on it, using the already existing structures, and then monitor the changes, because as years goes by, they continue to see, okay, are the student are kids being continually sent to schools? Is this change continually going on, or is just sparked and then it stopped? So I also was able to see in one of the communities in Labongogoro, which Walter mentioned, that who were able to come together and build a bridge, but it had come as a result of the community identifying that many of their children are not going to school, but they also were facing a challenge that going to school was hard because there was a river and there was no bridge. So, and especially for girls, that was very dangerous. But the communities gathered with their own resources. They didn't wait to, maybe for the government or for anyone to come and help them. They themselves organized resources to build that bridge. And they also contacted their neighboring communities who shared that bridge. Then they were like, you will bring wood, you will bring this material. And it was a collaborative effort that brought them together to actually establish a structure that will not only contribute to their development, but also help them to realize that they actually are part of the solution, that they don't have to always wait to be helped, but that even the solution lies within them. And that's also what I saw that CoLMEAL is making in the community, that it is making the community realize that you don't have to wait for the solution. You're part of the solution, and you also have the solution within you. And another experience that very impressed me was how in one of the community called Alenio South, they had received the training from ADRA about CoLMEAL, and they were also experiencing all these changes, having, reduction of like families that were having conflicts. But then they had another neighboring communities that was not having the training. So the other community got curious and they're like, there's a lot of change happening in these communities, and what about us? So they approached them and they're like, would you be willing to also come and train our clan leaders and members, and we provide our own resources, and that means provide their own refreshment for the training. And they were able to go in each clan and choose 5 people and bring them all these people together, and they received training. And when I visited, they also shared how levels of theft had reduced, levels of alcoholism had reduced, and even one of the member who had been separated with their wife for 6 years was able to reconcile with the wife and asked me how it went. It was in a very simple but very deep moment where he learned about CoLMEAL and he also learned about the theory of change. And he had understood that change actually starts with him. But then for him, he went into the CoLMEAL breakdown and it's like, community. And he was like, my community, how is my community? That is his family. And his family, they had separated. So it's like, my community is not doing well. So he went about monitoring and he was like, how do I monitor? I don't monitor anything. That also made him reflect and what are the learnings, how accountable he is. And I was so impressed to see that even in understanding and breaking down CoLMEAL in his way, in his understanding, brought him to the idea that it was right to reconcile with his wife so that he can again build his community, which is his family. And that only has not brought a good example in the community, but it also brings hope for families. And I saw that within all these communities, people do not only take CoLMEAL as this, very scientific or very technical. For them, it's like a message. It's a message they spread, and the message they talk, the message of change, the message of collaboration, the message of deciding what we want and follow up with what they want, the message of and understanding data in their own way as a story, not only just as numbers, but these numbers carries a story, and they use that story to determine the change. And it was also something I was able to witness with the Kulaka Open community, where they had a validation meeting. In this validation meeting, the CoLMEAL committee secretary would come and present the findings from the data collection of what that happened, and the community comes together to hear. Maybe we said that we are going to be cultivating cash crops. How many families did that, or who did that? How we at the start of the year we had a level of GBV maybe at this percentage. Now at the end of the year, how much percentage do we have? So I was also able to see and to witness how the communities are owning their data and are able to also decide the change they want to see. There's a lot I could share, just put some highlights on some of the observation I had. So thank you so much.
Wonderful. Sure. So exciting and so inspiring to start the year off with this positive approach to development. Thank you so much, Sandrine, and thank you, Molly, and thank you, Walter, in absentia. We have a couple of questions here. I see Fred wanted to know from you whether CoLMEAL is an upgraded version of participatory M&E, or is it a separate approach altogether? So I don't know whether Sandrine would like to address that one, or Molly.
Yeah, I'll take that and I'll probably hand it off to Alex as well. So I don't actually see it as an upgraded version of participatory M&E. And part of that is what is the driving purpose and how communities are involved. Often with participatory M&E, it's a fairly surface level involvement, or it's about problems that have already been decided, M&E structures and plans that have already been created, and you're just looking for input or some validation of results. But with CoLMEAL, it's much more deeper. It's about shifting the power so that the communities own and hold that whole process within themselves. And it's a replicable process for them. Even if the project leaves, they could continue with their own kind of actions and monitoring and evaluation and discussions and learning from there. But Alex, I don't know if you have anything else you'd like to add to that.
Yeah, I'd like to add another perspective to that, and it has relations to what you have mentioned, the shifting of power. Because potentially a traditional PME maybe doing it for the community, not like an external organization extracting data and then using it for that purpose of, say, a project, no? And then you have also the participatory M&E, which is kind of like doing it with them. In CoLMEAL, it's kind of like leveling up. It's advancing it from having like uh, doing it with them to that level where an external organization builds the capacity of that community to do it on their own. So in a way, it's like moving up that level of community development work, including that aspect of doing the M&E and the learning aspect.
Thank you. That's very helpful. And I think for me it kind of resonates with the asset-based community development approach that I'm so passionate about. And it's exactly that. I think it's, as you say, it's handing over and it's building up the capacity within the community to take this thing on. And I loved what Walter said, where he said, CoLMEAL has come to stay. And that's like there's an ownership there. There's a like, this is our thing now. This is not Salanga's thing, or it's not ADRA's thing. It's not somebody else's thing that they've come to give us. This is for us now. This is CoLMEAL has come to stay. It's in our DNA. It's in our blood. And then also, as Sandrine was saying, it's a message. People see it as a message. They see it as something to say, you have now shared this message with us. We are taking this message on and we're owning it and we are making it part of our community, so that another issue may come along, but it doesn't mean we have to sit and wait for that external group to come and say, you must now help us with this issue. We have the tools. We have this message. We have this new way of looking at things. It's like a worldview, actually, a different way of living our lives, that we now have the tools to say, here's a new issue. We're going to do the same kind of CoLMEAL process, and we're going to sort it out for ourselves. And the solutions are within us. We have those solutions. We don't have to wait for someone to come and tell us this is what you have to do. So, yeah, I love it. I see here. Thank you, Alex, for that. Anna is asking if any of the communities have explored why there may be such high rates of alcohol consumption, because often that is a symptom of something else. You know, there could be mental health issues or anything. Has that been explored at all?
Yeah, I think I may want to. Yeah. So I have this experience of joining CoLMEAL with Chere, that's a remote village. Also the Labunguguro cell that was mentioned earlier, and then Lukur North as part of the evidencing phase, which is like part of the overall CoLMEAL process. And there is this 3-level of analysis from the community where, for example, GBV has been prioritized as the top issue. And then they do some 3 levels of analysis why there is GBV. And the reason could be alcoholism. And then the second level, why is alcoholism there? It could be because of like, it is part of the culture. So the culture of drinking, and that culture of drinking, again, is like analyze why. And it could be because there could be other things, no? But the interrelatedness of, say, it is part of the local economy, there is opportunity to drink, and perhaps there's even this addiction. And that's the reason why Sandrine was mentioning earlier that the communities try to think about their own local solutions. And part of the local solutions included the bylaws and then even a lot of sensitizations. And that is to say that even without any external support, these communities have started doing their own solutions, their actions, because of their belief in what Walter was mentioning as the theory of change. But simply it is about like they're thinking of how the change will happen as a result of using the data, where they base their own solutions or actions, and those actions that brought about the transformation. So what was clear from the sharing of Walter and then Sandrine was this clear continuum of the use of data to bring about actions that bring about transformation. So I think that was the clear message there.
Lovely. Yeah. Do you want to add anything, Molly or Sandrine? Are you happy?
Maybe in regard to the alcoholism part, I had the opportunity to meet a man called James, and he had been an alcohol addict. And I was so impressed to hear his journey on how actually for him he was like the top. They have a way of ranking like you're the top drunkard in the whole community.
Yeah.
But what brought him to the change despite his addiction, because he said he would drink like for a whole month without eating, and it was very devastating for him and his family. But when he was able to make those realizations that the change starts with him, he was now willing to take the steps. And one of them was like to remove himself from the groups of his peers that were drinking, but also to have the will to be strong in his decision, because he mentioned how actually when you experience heavy drinking, you have issues with like dreams that will torment you at night, and all those issues. But one factor that contributed was how, being labeled in the community as a heavy drunkard, and then you start to change, and then the community members come and are encouraging him, like, you're doing well. Now he's like, oh, so, I am being recognized again. I'm gaining back my respect. So also that part of realization, though he's struggling to get out of addiction, which is not easy, but the community also supports his change, because already the community is adopting a change that will facilitate his healing, if I would say in that way. So I was able to see that also that personal will, personal decision for change also can be derived from CoLMEAL, because for him it was at that moment of understanding the fear of change, that change starts with you, and he then decided to quit alcohol. And I met him, he's now part of the community, contributing, and just that ability to realize your own issue, and even as hard as addiction, and decide your own steps, like what would make me change, also is something I wanted to highlight. Thank you.
Janine, can I just
Yes.
add to
Sure.
what Sandrine shared? Yeah,
Perfect.
can I
Yep.
add something? Yeah,
Absolutely.
yeah, because I know the person that you're mentioning here, Sandrine. I've also met him, and this has something to do with the emphasis on where transformation may happen. Would transformation at the individual level or a family level or a community level happen after implementing any of the planned actions? No. But here in the CoLMEAL journey of these communities, the moments of transformation may be as early as the assessment, where the community is trying to understand all those top issues that really matter to them. So that's one. So in CoLMEAL, transformation may even happen the earliest at the assessment of the issues, even before the prioritization. So that's one point. The second point was that so that drunkard who made that realization and the immediate transformation that happened during the assessment became part. He turned into a CoLMEAL committee leader, and he was leading the sensitization at the community level. So for someone as a community member, seeing someone who is truly like a drunkard and being now in the lead of sensitization, that is something.
And I think that leads on to the question from Jenny, is that what advice would you have for keeping participation in the whole process manageable for people, especially when people are volunteers or they might have other work or other commitments? And I think for me, with the ABCD work that I do, I think it's that personal transformation that you're talking about, both of you, Sandrine and Alex, that personal change that happened within James, and he now gets a different kind of a respect and a reaction from the community around him. That you're gonna stick with that because you are now getting something different from people. So, that for me, the participation, it doesn't link to a stipend or a pay, a salary or anything like that. It's a personal thing. You feel it, you live it, and you hold on to it. So I think, maybe you've got some other advice for Jenny to say, how do you keep the participation in the whole process when people have other commitments, they've got other things going on, but what is it that helps you to keep them part of the CoLMEAL process?
Yeah, maybe I'll start us off. So I think one thing that we aim to do within CoLMEAL is not to build brand new structures within a community. So when CoLMEAL is introduced in a community, we look to the existing structures and ask for accommodation of additional voices. So maybe there is a committee of some form, but they're not including youth, or they're not including women or elderly or people with disabilities. So we tap into existing structures so that we're not kind of creating arbitrary additional committees and groups to place further burden on the communities. But I'll pass it on to Alex.
Yeah, I've heard this one woman from Sri Lanka, and she mentioned that, we have a lot of organizations that went to our community, and they just came and then told us this is the way to go. But you are different in a way that you want us to sit down together, provide this space to think, to talk, to reflect collectively. That never happened before. And for us, it is important. That's what the woman said, while there was an elephant beside that venue that we were using. But the point being would be that, yeah, somehow the mindset really would be key for someone as an external organization bringing in something to the community. And the mindset would be, are we trying to do something for that community, or are we doing something with that community? Or are we now in that stage of saying, okay, we will be sharing with you some capacities so that you can do it on your own, so that eventually all of those principles for development, for including those monitoring, evaluation, and learning, will be owned by you and all the benefits that come from it.
So I think John is asking about the issue of alcohol abuse playing a big part in gender-based violence, but that's not really the root cause. It could be a symptom of deeper issues like the patriarchy and the male dominance in general. And Sandrine mentioned that people say, well, this is part of our culture. Can you comment on that aspect of it? How deep does the analysis, does the prioritization process, if you're getting people to think about, like you were saying, the why drinking because of this, why that, why going deeper and deeper with all the whys? Yeah, have you got a comment on that?
Yeah, I have. But Molly and Sandy, do you want to take this? Yeah, my take on this is, again, this is rooted in our mind setting, no? So again, when you say it's not truly the root cause, yeah?
Yeah.
We have that opportunity to say that is not the root cause. But in CoLMEAL, we are accommodating all the time. So whose perspective really? Yeah?
Yeah.
Whose perspective really is the root cause of any of those prioritized issues? Because by then, who really knows well the situation? From an academic point of view, it could be anything like mental health issue or anything like what we have in mind that is part of our mindset, our thinking process, apart from the lived experiences that we have with some GBV cases in our country context. But see, in this CoLMEAL approach, what really matters is how the community prioritize the issue and then analyze the root causes, because their understanding of the root causes bring in the locally driven solutions. And who will do the solutions? It's not us, really. In the CoLMEAL approach, you will see these communities doing their own locally driven solutions, even without the external intervention. Like in Loreng in Kenya, when we randomly selected Loreng to do some evidencing visit, the implementing partner was so concerned, like, oh my goodness, this is like the worst to be randomly sampled. And when we went to Loreng as a community, that's the thing they have realized. Oh my goodness, there's a lot of things that we haven't picked from all of those monitoring visits. And it has something to do with the lens that they have used. So again, the mindset is key. So even in that comment, even in that thinking that, yeah, it's not the root cause, but this and that, then whose perspective then is it? In the same way that we are asking, whose change agenda is it really? Is it from the community? Is it the external organization bringing in the agenda, the change agenda, which Janine speaks to what you were saying earlier. And it may touch on localization, which is like that global push for shifting the funding more and more to local actors, like country organizations, national organizations, no? But in CoLMEAL, the shift is really towards communities exercising their own agency. They're exercising their decision-making power. Even a very simple root cause analysis. So whose perspective?
Yeah. Whose process is it anyway? That's one of my favorite ABCD phrases.
Exactly.
So this leads on to Judith asking that how does either ADRA or Salanga provide support to these CoLMEAL groups through the process, like before, during, and after, if at all? Or maybe, as you're saying, once they get it, they don't need that support anymore. They are, they do it by themselves. And then also, what have you seen in terms of maintaining those observed positive changes so that they last and become embedded?
I'll try to jump in to give Alex a bit of a break. So, Salanga serves, like I've said, as the stewards of the approach, and we provide capacity sharing to the ADRA teams in country through virtual and in-person training, particularly Alex, who's our kind of main CoLMEAL advisor and was really a big part of developing the CoLMEAL approach. So Salanga provides that capacity sharing. Those teams then localize the approach and to provide capacity sharing in communities, and particularly tapping on leaders, not necessarily traditional leaders, but some sort of person to be a lead facilitator within their community to support their community to move through the process. And it kind of goes step by step through that. So with ADRA supporting the community through step 1 and then going back to step 2. And then it is cyclical. So once they've had that first cycle and they're confident in going through the steps, then they can move forward with less frequent support and less frequent visits. But it is one cycle, like the first cycle often takes about 10 months to go through because it's like one step at a time of doing that capacity sharing, allowing the community to take that step and do the actions, and then doing the capacity sharing again. In terms of observing and maintaining positive changes, I think we really have seen things be embedded in communities. This focus on alcohol really is in the Ugandan context, but we see in northern Kenya quite a big shift in norms around early marriage and communities dedicating to that. They won't allow that any longer in their community, and that's a really big norm shift to come about from the approach and these conversations and we've said, this kind of mindset shift that people go through, and it isn't a prescribed or wasn't said to them that this should be the topic of their change. It was drawn out of the fact that people who usually don't have their voices heard were able to speak up and change the mindset of others within their community. But if Sandrine or Alex have else to add, please go.
Let me just move on with a few more questions because I'm just keeping an eye on them. We've got 15 minutes left. Anna was asking, how do state agencies, local councils, bodies, etc., how do they engage with this? Because obviously, with government bodies and so on, they have a responsibility around certain statutory things. How does CoLMEAL work together, with a multi-stakeholder involvement?
Right. I can speak for ADRA Uganda in the absence of Walter, but because I'm quite into how they are doing their CoLMEAL journeys with the community, and it's something to do with their strategy of inviting these higher local council members to observe the CoLMEAL process that is being done by the committee members from the community itself. But not just like the local councils, but the higher local councils, but also representatives from the cultural community. So in the context of Uganda, the government has recently introduced sometime in the early 2020s, the parish development model. And so it was very interesting for the parish development councils to observe the CoLMEAL approach so that the model would have the methodology. So they were introduced about the structure, but not the methodology. And so observing this from how the communities were doing it alongside ADRA Uganda. So, for example, I think it was Alenyo parish that decided, okay, we are outside your project scope, but we are interested with your CoLMEAL approach. So we will use our own parish funds such that ADRA Uganda can train us and so that we can adopt the methodology. In the same way that ADRA Uganda also invited the 45 cultural leaders from 5 clans somewhere in the Padivi sub-county. And that these cultural leaders as well, after observing, also decided, okay, we also have some funds, our own money to spare, but just go to us, train us, and we will adopt the approach.
And I think that's important because it leads on to Bob's question where he's saying, to what extent is CoLMEAL political in that coming together can potentiate conscientization? So you can, people evolve a critical awareness of their social reality and the political and social contradictions that impact on our lives. And I see this also with the ABCD. People say, oh, but sometimes you get a little bit political because people are now
recognition from the likes of Colin. Like Collins is the local council 2 member. So that is at, I think, closer to the sub-county level. And I think some of the local council leaders also talked to the commission for the community health management program. And so a commissioner from that commission went down himself to observe the CoLMEAL process. And after observing the process, he called for ADRA Uganda so that they will be briefed about the methodology, the approach.
And
excellent.
Just a bit, it's not directly answering Bob's question, but there is a stage in the CoLMEAL process where communities are built their capacity to do advocacy. So it's recognized that they might identify a problem, and there's a solution that they can do, and then there's a solution that they can ask for help with. And so that kind of differentiation is part of the work, and then going to their kind of relative political bodies to ask for that help, ask for those changes based on the work. And often the data that they've collected allows them to have a better voice in that work.
Well,
just to add to you.
Yes, go for it.
Yeah.
Sorry, just go on.
Sorry, I just wanted to sort of take it a little bit further because I think it's a community development quandary for all of us. At the end of the day, what we're opening is Pandora's box over and over again, because of people living exist in the reality of their political environment. And what was presented was very much a pretty standard asset-based approach, which was we've got problems, let's deal with them ourselves. But a lot of those problems are sort of structural at the end of the day. And at some stage we've got to address that. All I was asking in my question is what thinking is going on within Salanga and around that process.
Thanks, Bob. Alex, Molly, anything to add?
Yeah, I was thinking around the lines of, like, there was a mention from either Sandrine and Molly that this is like a cycle for the community adopting the approach. No, and that, of course, you're right in saying, Bob, that, for example, a GBV sits above a system of causes, no? And so therefore, all of those systemic structural causes will need to be addressed. But then again, the community will now select which one they are capable of responding to, addressing to. And then, as Molly mentioned, there is this option to advocate for support from external organizations or external to their community, like the higher local councils. In the case of Rumuni commune, for example, in Cambodia, they didn't have enough money to support all the sensitization against children being forced into sex work, because that is fairly common in Cambodia, as well as GBV. And so they sought the support from the commune council that holds the fund. And so for the next 3 years for Rumuni, that community was able to secure the funding only for doing the sensitization for the issues that they wanted to address. And so part of the money that was used for those sensitization was leading now to some form
we've lost you, Alex.
But in reality, all those solutions will, yeah. But of course, not all of those locally driven solutions are like effective, no? In the case of Buruk Busuk in Buhi in the Philippines, so the community did all they can. So all the locally planned solutions were already implemented. But then early marriage was still up. Yeah. So early pregnancy, teenage pregnancy was still up. So when we did the evidencing visit, the main process for the community was a big question mark. What did we do wrong in the assessment? What did we do wrong in the planning exercise? What did we miss? And so it moves to the second cycle and the next cycle of data points, such that they will be able to see there is an increase, there is a decrease, but that is not the point. That is not the only point. The point would be, how do we adapt to this data, to this trend that we are seeing? So when we left that community in Buruk Busuk, they were planning to review their own assessment and their own action plan and change plan.
Yeah.
And I'll just jump in that we are now piloting in our current project with ADRA to implement some aspects of CoLMEAL within institutions. So the various country teams, ADRA Uganda, or ADRA Kenya in this case, ADRA Philippines, and ADRA Cambodia, are going out and identifying which government body they want to connect with based on the themes of the project, and trying to work with that body to update its processes or systems to be more community-led, to allow more community voices to. So in that way, we are working on kind of that structure and thinking about how CoLMEAL can be applied at various scales.
Excellent.
Part of the inspiration for the mention of Molly bringing in CoLMEAL into the government institution level was the organic adoption of the approach from the Department of Justice Probation Office in Kenya. So they used the approach for some of the rehabilitation of those who violated the laws, and then linking back into the community service that links to the community action plan and change plan. And Sandrine actually did a complete case study on that, and she knows better. I'm just excited to share that. Sorry.
No, that's excellent. Thank you. Are there any more questions? We've got about 4 minutes left. You'll see in the chat, Daniel has mentioned the next webinar is on the, where have I gone? 11th of February. Am I right? Yes, 11th of Feb. Looking at community leadership skills. And Jessica has shared with you the link for the conference, the Glasgow conference. It would be wonderful if some of you could attend that. I'm going to quickly also share, we are doing an online ABCD training for African participants. So anybody living in an African country is welcome to join us for February to March, 6 weeks, 3 hours once a week. I've put the link there for you on a Quicket thing. You've got all the details there of the conference. But yeah, and John has shared Embrace Everyone, their social inclusion blog site. So many assets and so many wonderful resources we have in our family, hey? So I think on this note, I don't know if Anna would like to end off with anything, or Daniel.
Thank you, Janine. I was just looking for another link to pop into the post there. Well, thank you everybody for joining today. It's been very interesting. I think there are a huge number of connections between the CoLMEAL approach and community development, certainly as we would describe and define that within IACD. And particularly those underpinning values as well, all of which is information, if you're not familiar with, you can find on our website. And really just to say that, we have a rolling program of webinars. They're often hosted from within one or other of the global regions, but they're open to everyone unless otherwise specified. So between now and certainly the end of March, I think we've probably got about another 10 that will be coming up. So please do keep an eye on our events page, and we look forward to seeing you at those in the future. Thank you to the contributors today too. And also just to say again that we have the World Community Development Conference. I know the link is in the chat there, but we are very, very keen to try and ensure that that is as inclusive as possible, albeit there are obvious costs associated with it. But please do have a look at the details, and if you are interested in joining, we would love to see you there. And I'll leave it at that and hand over to Daniel. Thank you.
Thanks, Anna.
Thank you so much. And mine is to thank you all for creating time to be part of this first of our, in the edition of our series of webinars for this year. And as Anna has indicated, it's going to be quite a chunk coming through. And you are welcome to join all the time. As I indicated earlier on, as we were starting, again, is as colleagues come up with a topic, we schedule you, and you take the floor and lead so that we all become better at what we want to do in our profession, in our practice, in our discipline. And as we conclude, again, I'm so glad that as we were getting to the end of yesterday evening, Water wrote to me that the government and shared the government official communication that internet services will be closed down in the interest of managing the elections in Uganda. And so there was that kind of now panic. How do we move forward? Community development is about being flexible and being creative, and of course using the resources that are available. And within moments, in consultation with Molly and Alex and Centrine, a backup plan came up, and Walter was able to record his presentation, and here we are. Out of that, we want to acknowledge Molly has had to wake up at 3 in the morning to be able to lead us through this process. Can we give her a round of applause? So thank you so much, and enjoy the remainder of the day, the remainder of whatever time it is in your region, and Happy New Year.